So I'm enjoying what's happened over the past week with this YouTube channel, where I've been making videos answering comments and then getting more comments, and then making more videos answering comments and then getting more comments. And it's kind of making this lovely para-social conversation happening. And I got another wonderful comment, a really interesting one. So let's just keep having this conversation. So today's comment that we're going to be talking about says, if the structure of personality is how one relates to others, how one relates to the self, and how one tolerates and reacts to stress, how does this framework apply to dissociative identity disorder? For me, the separation of self states can be overt, particularly under stress, and absolutely have their own personality, in some cases cluster B personality disorders. Is this separation and multiple presentations of interrelating with the world why it is identity rather than personality? Wow, that's a really good question. I hope I can do it justice in my answer. So full disclosure, I've read up quite a bit about dissociative identity disorder, but I've probably only been involved in the treatment of about 4 or 5 people with dissociative identity disorder that I was aware of. A lot of people have it, and no one but them kind of know. It runs silently, and one of the people I treated had been known to mental health services for years, and it only came up in our review years into his treatment by multiple healthcare providers, that actually he was operating with this really fragmented self state. So I'm no world expert, but I have a workman's knowledge of the syndrome, and so we can talk a little bit about it. So in this video, I want to break down this comment, talk a bit about dissociation as a defense mechanism, which makes up a part of personality, talk a bit about dissociative identity disorder, which is a bit different to personality structure, and talk a bit about the differences between identity and personality. That's all I plan to talk about, but you know how these rambling videos goes. We could end up anywhere in a matter of 5 minutes. Anyway, if you're new here, welcome. My name's Dr Syl. I'm a junior doctor from Australia. I'm training on the psychiatry training program, but these videos are made in a personal capacity. I'm not representing any college or workplace. Engaging in this content does not constitute a patient-doctor relationship, and all advice is general in nature. There's no personalized medical advice in these videos. Gosh, I'm getting quick at that disclaimer, aren't I? Anyway, let's get into the video. So, what is dissociative identity disorder? Look, I'm not going to go into the DSM and read out the list of symptoms and criteria and check boxes that you have to tick to fulfill a diagnosis. When I think of DSM criteria and stuff, I recognize its importance, but I don't feel you understand the illnesses that it's talking about just by reading a set of criteria. So if you're studying for an exam, for example, this might not be the video for you. There's plenty of videos that go through the DSM criteria or what it is. But I'm just going to talk about from a kind of interpersonal, just from how I think about it. So dissociative identity disorder, it's someone very often who has undergone complex, grueling, repetitive trauma in early phases of development, early life, that in order to survive whatever trauma they had to endure, had to fragment their self. A child cannot conceive of a caregiver being evil. It's not evolutionarily part of how a child thinks. They idealize caregivers. Caregivers, parents, are these all-powerful saviors, and a kid will cling on for dear life even in the most horrendous circumstances. And so there are different ways that that children can manage that incredibly painful dilemma when the person giving you care is also a perpetuator of trauma, because those two things aren't compatible in the mind of a developing young child. So one of the defenses that kids can go through is something called dissociation. Dissociation is a defense mechanism we've all used, and it's not always pathological, right? We've all driven a car. Well, we've all found ourselves dissociated. So many of us will have driven a car and, you just kind of realize all of a sudden, damn, I've been driving for 20 minutes. I wasn't even aware. Like, did I go through a roundabout? I'm at home now. What just happened? That's quite a dissociated state. The world around us is extremely dissociating. We're going through our phones. We're disconnected from our bodies. We're in these other worlds. So dissociation is very common. When we think about it as a defense mechanism, it's a bit different. And it exists on a spectrum, like all defense mechanisms do, of more adaptive ways and less adaptive ways. So what is it? Well, it comes from, how we protect ourselves from the pain of death. So when you're getting attacked by a lion 100,000 years ago, it's not evolutionarily advantageous, but it is psychologically advantageous to disconnect from your body while you're getting eaten by a lion or a saber-toothed tiger or whatever. And so it's the experience of separating from the body. Looking at your body from a third-person perspective is one way that it manifests. That's called depersonalization. Another way it manifests is through looking around and feeling like the world you're looking at isn't real. It's almost like you're looking at it's like watching a TV show through your own eyes. You touch things and you're not quite sure it's real. And that's called derealization. Now, those are the two kind of common subtypes of dissociation, but I can tell you from, I'm relatively junior, but from my brief experience, I can say over the past couple of years, I've seen it manifest in lots of other ways. And it can be vague lightheadedness. It can be all sorts of kind of vague things. But depersonalization, derealization are the two common ways we think about it. So that's the defense mechanism of dissociation, and that's how it kind of manifests in an adult. In a child, what happens when you have this ununderstandable dilemma of having a caregiver that's also a traumatizer, I guess, it can't make sense in the mind. And so what happens is you need to form a split. Because there's the caregiver that does help and care for you, and then there's a caregiver that does hurt you, then there must be two yous, because there can't be one caregiver doing these two opposite things. So instead of understanding that one person can be helpful and hurtful, a child can't understand that. So instead they split themselves into two self states, and one is the receiver of trauma and one is the receiver of care. And that's the theory around how it starts, but what happens through life is that it fragments further and further as stresses and different stressful events come up in life. Now, this is actually quite adaptive when you're a child undergoing trauma, because you can't fight, you can't flight, you can't run away. And so you have to learn how to escape from within with these defense mechanisms to survive. So you disconnect from your body, it undergoes the trauma, and then you reconnect with your body later, and life goes on, and you survived, right? That was helpful to get you through that, situation you never should have been in, but it got you through it. When it becomes a disorder is later in life, when it's no longer helpful, when someone asking you if you wanted to pay with cash or card triggers an episode of dissociation, or a switch between personalities. You didn't control that. It doesn't even seem that stressful. Why am I flipping? So that's when it becomes a disorder, when you've lost control of when you dissociate, and it's causing functional impact. It's affecting the quality of your relationships, your ability to work, your ability to live life the way you want to live within reason. So that's what crosses the threshold into disorder. So when someone has a dissociative identity disorder, has multiple personalities, and from what I've seen, the average seems to be around 5-ish. There tends to be a bit of a pattern. I haven't looked into the research for this, but I've tend to see that there's usually a vulnerable child, a kind of angry or agitated persona or personality. Sometimes there's a sexualized personality, a kind of dramatic sexualized in part of the personality. Then there's the kind of main personality. So there is usually a kind of boss in charge. And then, the other one is kind of depending on the individuals. I've heard of some patients have up more than 12, so it can vary. But anyway, so obviously if you're in different states, it's debilitating, but because often different states don't talk to one another, and people can have massive lapses in memory and experience, and they can find themselves in situations that they don't know how they got there. They could be lost. They could have committed crimes or regrettable actions like affairs and felt like it wasn't them who did it. So very disabling condition, and there's stigma around it. There's some people who argue that dissociative identity disorder doesn't exist. It's a bit of a controversial area, so quite a significant disorder. Anyway, I think we've talked enough about dissociative identity disorder. I hope you get the sense of what it is. So now we've talked about the dissociative identity disorder, and we've talked about the defense mechanism of dissociation. So if we look back at the question, which is asking about how this definition of personality in terms of how people relate to others, the self and stress, and how that relates to dissociative identity disorder. Well, the relationship is in someone with a dissociative identity disorder, they usually have a dissociative personality structure, and their main defense mechanism is what we've talked about, dissociation. It's hard to generically speculate how that influences attachment, but it would likely be that if someone has a dissociative identity disorder, that they're in the either anxious dependent or anxious ambivalent attachment style. So what that means is either disorganized attachment styles. So what that means is that in the relationships that they formed, there could be significant abandonment anxiety, that they need the relationship in order to feel whole because they have a sense of emptiness in them, and that the thought of separating from the other, from the partner or the friend or whatever, causes such severe distress that they might do maladaptive, unhelpful actions, consciously or unconsciously, to try and preserve the relationship. So it's interesting to look back at this comment where the commenter talks about how one of the self states, one of the personalities, has cluster B personality disorder. So if we're talking about a borderline personality structure, which when we talk about borderline personality disorder from the DSM lens, it's talking about someone who has quite dramatic, overt, sometimes masochistic, like self-harming and suicidal ideation tendencies. So I use the term masochistic there, not as in they get pleasure from hurting themselves, but they get emotional needs met from hurting themselves, which is a bit different to how it's often used. So, so what we're saying is some parts of the personality in this commenter is in this borderline range, and maybe meeting the criteria of a personality disorder within the identity of the commenter. So complex stuff to wrap your head around, isn't it? I think to help understand that, I think at this point we should talk a little bit about identity and personality. Look, identity is a broader term, right? Identity is this strange mix of multiple parts of experience and the self that involves time, ego continuity, involves memories, it involves certain beliefs about the self and who you are, it involves your personality, obviously, it involves emotions and how you express emotions. What else does it involve? It involves values, and it involves boundaries. So that's an important one in the self. So psychosis is really a disorder of the self in a sense, because people who are psychotic lose the ability to know when their boundaries end and when the outside world begins. So someone with paranoia might think that the fly on the wall that fly is independent of their self, but there's a connection there that they think it is related to the self. They think it's a CIA, spy device monitoring them. The self is being projected into the fly. Maybe that's not the best example. For example, hearing voices, right? They're hearing the voices like it's an other thing, but it's actually them. It's their brain. So that's part of their self, but they see it as something separate. So there's an issue in the boundary of what is self and not self. Hearing voices can also be conceptualized as a form of dissociation, right? It's an experience of the self that is so dissociated that it sounds like it's another voice. It sounds like it's a different sense, like it's coming outside in the room. So rather than it being a thought, which it is, right? It's an auditory hallucination. It's coming from the brain. It's a neural process in the mind, but it sounds like a sound in the room. It's so disconnected. And obviously that has implications for what brain structures are involved and things like that. All right, let's bring it back. So what have we talked about? We talked a little bit about dissociative identity disorder. We talked a bit about dissociation as a defense mechanism. We talked a bit about the differences between identity and personality structure, which are, identity and personality are separate but interrelated concepts. And now I guess it's probably a good time to talk a bit about what to do if you or someone you know has a dissociative identity disorder. So look, without doing an assessment, I can only speculate. And what's important is ego consistency, ego continuity, a sense of sameness, a sense of being one person. And when someone is extremely fragmented, it causes problems in lots of parts of life. And through specialized therapy, especially with a therapist with experience and training, that those different self states can integrate again. Often they don't talk to one another, and often it's helpful to try and help them communicate to one another. So there's different strategies to do this. One of them is, what's it called? It's when I think it's called like an internal meeting, or it's got a funnier name than that. It's got a quirky name. But anyway, it's when you imagine a table, and you can actually get a table and you put the chairs and you get all the different personalities to talk to one another, to connect, to reintegrate, to start lines of communication, to essentially form a new self that is involving everyone. This can be really difficult because often the different selves, as we've kind of touched on, can have different coping stress management situations. Like one of them can be using sexualization to manage stress. Another one might be using borderline personality disorder defense mechanisms to manage stress. One of them might even use psychotic defense mechanisms to manage stress. And I guess we didn't talk about it in the comment, but yes, stress can make you regress, right? Okay, if you've made it till now, 20 whatever minutes in, if you've made it till now, remember this, it is not the absence of immature defense mechanisms like sexualization or repression or acting out. It's not the absence of that makes you a mature individual. It's the presence of more mature defense mechanisms like sublimation or altruism or humor. But under certain amounts of stress, anyone can regress into lower levels of functioning and less adaptive defense mechanisms like dissociation, like acting out. I can, you, anyone, right? It's just the amount of stress. And when I say stress, it could be family members dying, getting into fights, all sorts of psychosocial things stress us out. So it can come from lots of different angles. So anyway, that's an important point to end on. But I guess, I'll probably cut the video here. But to terminate, the main point is if you have a dissociative identity disorder, there's no kind of medication that integrates personalities or fixes dissociation. If you do experience dissociation, there are grounding techniques you can look into. I've got some videos on those. If you experience a dissociative identity disorder, you can look into therapy to integrate the different personalities. It takes time, it's hard, it's expensive if it's not funded by your government. So I recognize there are barriers to accessing these treatments, but yeah, it's just the world we live in. There is hope. There's a lot of hope, because you can live a fulfilling life and integrate these different personalities. And I wish you all the best in your journeys. Thank you for that wonderful comment to Purely Ambi. I really appreciate it. If you have any comments or questions you want to put in, comment into this video. If you enjoy this kind of content, please consider subscribing and liking the video. That helps me out. And other than that, I just wish you all a beautiful day. All right. Bye for now.